If I were talking to someone who was hesitant about becoming a patient advisor in the area of research, one thing that I would tell them is to exhale and that it would be fine. There's a significant amount of training and preparation work that you go through to make sure that you are strong.
Yeah, one word to describe my experience is gratifying, because I know that one person can't change the giant healthcare system, the landscape that's out there. But if each of us did a small part, a teeny little part into making this work for other patients in the future, it'll be a small step towards finding solutions to big problems.
Meaningful patient engagement is not just about participation, it is about partnership. It ensures that the voices, experiences, and priorities of patients shape the research process in a way that leads to better healthcare outcomes and a more patient-centered healthcare system.
Our research arm provides services to the healthcare system and beyond on things such as patient-centered research, interviews and focus groups, survey development, and we specialize in qualitative and mixed method study design and data analysis. Meaningful patient engagement in research helps ensure that studies focus on patient-centered priorities and increases the real-world relevance of the findings. PERK is dedicated to incorporating the patient perspective into the research process. We are always open to collaborating with teams at Henry Ford Health and other organizations. We do have an intake form for teams looking to work with us. PERK also leads our own funded projects. In 2023, PERK was awarded a Science of Engagement Award from PCORI, which was the first award of its kind to be given to Henry Ford Health. The project is called Peer Ideas, and it is a survey validation study. The unique part of this project is that we are including patient advisors in research in a brand new way. We invited patients to not only advise our studies, but to actually become co-researchers on the team.
I'm specifically a research patient advisor on a funded project called Peer Ideas, which focuses on survey validation. And my participation in this project goes beyond simply attending meetings and giving my 2 cents worth feedback. Along with 6 other patient advisors, I'm a co-researcher on a study team. As a co-researcher on the team, myself and the other patient advisors underwent training to learn how to moderate focus groups. We learned how to work with each other, coming up with a focus group training moderator guide. So it was a great experience.
How patients are engaged in research. Through PERK, various strategies are implemented to ensure meaningful patient engagement in research. Co-designing research studies. Involve patients in shaping research questions and methodologies. Advisory panels and patient committees. Regular engagement with patient advisory groups provides ongoing feedback. Accessible communication. Ensure research findings are shared in a way that is understandable and actionable for patients. Compensation and recognition. Value patients' time and contributions, offering appropriate compensation and acknowledgement.
As a patient advisor, I had the opportunity to attend a national conference, the Healthcare Systems Research Network Conference. And at that conference, I got to tell what my experiences were with the research work that we had done. And one of the things that was most impactful to me, or maybe a revelation I had, is that it's really unique to have patient advisors included in every phase of the research activity, like I experienced at the Henry Ford system. And I also appreciated the level of interest that was there from the other attendees at the conference, and the thought of the work that I was participating in or contributing in being expanded across healthcare organizations all across the country was very special to me.
If you are a researcher, we invite you to think differently. Think collaboratively. Patients and caregivers bring lived experiences, insights, and questions that you won't find in charts or data sets. When you bring them in as true partners, your research becomes more meaningful, more impactful, and ultimately more human.
If you are a provider, researcher, or community member who is looking to collaborate with PERK, or you want to include patient advisor voices in your initiatives, you can contact the PERK team at perk@hfhs.org.